Hello, my name is Lum Tran, and this is my final project for the HPS 405 Biology and Public Health class. For my topic, I'm going to be discussing type 2 diabetes mellitus in the public health context. So, for the objectives of this presentation, I'm going to be talking about the biology of type 2 diabetes, and then I'm going to be talking about the epidemiology, the socio-ecological model implications, and the programs and interventions. Diabetes is a chronic condition that leads to hyperglycemia. It does this by impairing the body's metabolism, affecting how it processes and stores energy. The two interconnected mechanisms of type 2 diabetes responsible for this are insulin resistance and glucose metabolism. Individuals with type 2 diabetes will suffer from insulin resistance. Insulin is a hormone that controls the amount of glucose in the body by transporting glucose into the cells for energy. Insulin resistance prevents the cells in the body from being able to respond well to insulin, preventing insulin from entering the cells. Glucose metabolism is the breakdown of carbohydrates into glucose, which is then transported and used as energy by the body's cells. However, due to insulin resistance, the body's glucose metabolism becomes unstable, as cells are unable to respond to insulin. This leaves more glucose in the blood, resulting in higher blood glucose levels. Chronic stress significantly impacts type 2 diabetes, as it triggers stress hormones, cortisol and adrenaline, that raise blood sugar and worsen insulin resistance, which contributes greatly to the progression of diabetes. Dietary factors also affect disease progression. Consuming sugary drinks, refined carbs, unhealthy fats, and processed meats are all examples of foods that are commonly known to increase the likelihood and or worsening of type 2 diabetes. There are various risk factors that can make someone more prone to contracting diabetes, such as their socioeconomic status, their lifestyle choices, and differences in demographics, such as gender, location, and etc. Lower socioeconomic status significantly increases diabetes risk, prevalence, and complications due to factors like food insecurity, limited healthcare access, lower education, job stress, and access to less nutritious foods. Lifestyle choices dramatically impact diabetes risk and management, with healthy habits like weight loss, regular exercise, a diet rich in whole foods, and low in sugar/processed items, and avoiding smoking significantly lowering type 2 diabetes risk. Those who come from minority racial groups tend to have higher rates of developing type 2 diabetes, with many of these groups residing in more rural settings. Additionally, men reportedly have a higher chance of developing diabetes in comparison to women. According to the socio-ecological model, diabetes affects us in multiple different levels, such as the individual level, the familial level, and also the communal level as well. At the individual level, type 2 diabetes significantly impacts the individual's health by causing severe complications. These include heart attack, stroke, blindness, kidney failure, nerve pain, and possibly ulcers and foot amputations. At the familial level, type 2 diabetes affects families through emotional burdens such as stress and worry. It can also affect the practical lifestyle, as there will be changes in diet and exercises and routines, and there will also be financial strains due to medical costs that comes with type 2 diabetes. Type 2 diabetes impacts communities by straining healthcare systems, increasing economic burdens, and exposing health disparities in neighborhoods that may be lacking resources, such as grocery stores and farmers markets, and much more. The healthcare burden of type 2 diabetes is immense, with the US spending over $400 billion annually due to health complications like heart disease, kidney failure, blindness, and amputations, which require increased hospitalization and medication needs. Potential public health policy changes could include providing access to healthier foods. Many areas where individuals from lower socioeconomic classes reside often don't have access to healthy foods. Making policies to make more grocery stores could help making healthy eating more accessible. The National Diabetes Prevention Program is a community-based public health program developed by the CDC to prevent type 2 diabetes through evidence-based lifestyle interventions. It is done through YMCAs and community centers, and the program is focused on prevention. MyPlate is an individual-based public health campaign developed by the U.S. Department of Agriculture. MyPlate is aimed at helping Americans understand basic nutrition by helping them know proper proportions and how much of each primary food group they should consume with every single meal. So in conclusion, type 2 diabetes is driven by insulin resistance, which disturbs glucose and metabolism. Factors like chronic stress, diet, physical activity, and socioeconomic conditions are all contributing factors to diabetes. Interventions through policy changes and public health campaigns are essential to preventing type 2 diabetes.